Welcome to the Accident and Emergency Department at Jahangir Hospital, your dedicated facility for urgent medical care. Our committed teams of doctors are here to provide immediate and expert assistance, ensuring that you receive the highest standard of medical attention in times of need. From minor injuries to life-threatening emergencies, our state-of-the-art facilities and compassionate staff are ready to assist you with the support of advanced technology to handle a diverse range of medical situations, ensuring that every moment is utilized efficiently in delivering top-notch care. Let us take you through the streamlined procedure that is followed here at Jahangir in cases of emergencies and accidents. At Jahangir Hospital, we recognize that emergencies are unpredictable and our unwavering commitment to being available 24/7. Code Cardiac. On receiving information about any cardiovascular emergency, the ER desk activates Code Cardiac. The bay is cleared as the ambulance doors open and the patient is wheeled in on a stretcher into the resuscitation room. When a patient presents with symptoms suggestive of a heart attack, every second counts. Early intervention is crucial. The ER team, in coordination with the cardiology team, works together to perform necessary tests and procedures.
So myocardial infarction or heart attack is a life-threatening emergency. Whenever a patient comes to ER with chest pain, breathlessness, sweating, giddiness or any of these symptoms, it is crucial for emergency medicine doctors to detect that it is a heart attack or myocardial infarction. Once it is detected that it is myocardial infarction, we inform cardiologist and code cardiac is announced. Once the code cardiac is announced, the whole team is activated. That is the billing team, the cath lab team, the anesthetist team. And then simultaneously, the patient's relative are counseled about the clinical condition of the patient and the need for further treatment, that is angiography and SOS angioplasty, that is called as PAMI, as required.
The team gets the 2D echo done and explains to the relatives the importance and necessity of early angiography followed by angioplasty.
It is a very important aspect because during a heart attack, the time factor is very important, and what we call it, time is a muscle. So the shorter time you can do an intervention, an angioplasty or a procedure, you can save the muscle. So the word is time is muscle. So this is very helpful because the process is set so you can do everything very fast, and the faster you do, you can save the heart muscle, you can save the life of the patient.
Post-angioplasty, the patient is shifted to the ICU for further monitoring and care.
So when any patient comes with a code cardiac to us with the symptoms of heart attack, like chest discomfort, jaw pain, bilateral shoulder pain, breathlessness, or any untoward symptom, excessive acidity, and then on ECG when we realize it's acute myocardial infarction, heart attack, we generally we announce code cardiac, irrespective of the time of the day. It could be in the morning, the normal working hours, or it could be in the middle of the night. Probably in most of the cases, the artery is opened up within 60 to 90 minutes of patient's arrival to the hospital, and which has been globally recommended. So we are proud to say and tell people that if anybody gets a cardiac episode, getting cardiac attack, come to the Jahangir, we will take care of you. We have all protocols set in place, so we take care of the patient as early as possible to save myocardium.
Code Stroke. In the case of a stroke emergency, Code Stroke is activated. The patient is quickly wheeled into the resuscitation area where monitors are attached to track vital signs, blood pressure, pulse rate, and oxygen saturation. Medical staff work swiftly to establish IV access while assessing the patient's condition. The patient undergoes a series of imaging tests to confirm the diagnosis and assess the extent of brain injury. The ER consultant confers with the neurologist, reviewing the test results and discussing treatment options.
A stroke is a life-threatening medical emergency. Our emergency physicians in Jahangir Hospital are trained to identify signs and symptoms of a stroke. A patient may present with weakness of a limb, slurring of speech, drooping of the mouth, gait imbalance, or some visual disturbance. Our emergency physicians identify these symptoms early. They also find out what the onset of symptoms is. If the patient presents to the emergency department within 4.5 hours of symptom onset, it gives us a therapeutic time window and we begin to act very fast here. When the patient enters the emergency department, an initial quick neurological assessment is done. Their blood sugar is checked, an ECG is done, and the patient is shifted for a scan, for a CT or an MRI. Here, we rule out if there is a bleed in the brain. If there is no bleed, then the patient can be offered a clot-dissolving medication or a thrombolytic agent. Once the patient's relatives are consulted about the same, then this therapy can be offered as soon as possible. So here we try to limit the door to needle time to less than 60 minutes. When the patient enters the emergency department and this treatment is administered to the patient, that time window is less than 60 minutes. And we've consistently followed this over many years. Our emergency physicians are trained to administer this medication after consultation with the neurologist. A code stroke is announced in such a case, where a public announcement system alerts the neurologist, the radiologist, and the intensive care team. Once the patient is administered this treatment, we also consider mechanical thrombectomy or endovascular therapy for the patient. This patient is then moved to the intensive care unit where further care continues. So this is where the role of an emergency physician is very crucial in case of a stroke.
In the Jahangir Hospital, we also monitor patient as well as the patient's door to MRI time. During the thrombolysis, patient's monitoring is very crucial for any worsening or the improvement in the patient. For the code stroke, when we are transferring patients to the MRI or the CT scan, we are having the stroke kit with all the drugs and the emergency kits.
The ER doctor counsels the patient's relative, providing information and support during this critical time. Thrombolytic agents are administered to dissolve the blood clot causing the stroke. The neurologist intervenes, providing specialized care and guidance throughout the treatment process.
It is a multidisciplinary approach to treat a stroke patient, where it involves the immediate, within minutes, rapid examination of the patient and assessment of the patient whether he had a stroke, and patient is within minutes taken to the CT scan, and where the CT scan is taken or MRI is taken, and decision is taken to do a further line of management in form of IV injections to thrombolysis, and if required in angiography, if patient has a big clot in the major vessel of the brain, then we do mechanical thrombectomy by our expert interventional neurologist, and patient is taken care to the neuro ICU immediately, and further management is done. So in that way, we have got comprehensive stroke care, start from the emergency, neuro ICU, then neurology wards, neuro rehabilitation, physiotherapy.
The patient is stabilized and shifted to the ICU for further monitoring and care. Code H. In the cases of massive bleeding, rapid implementation of treatment is started with Code H. Medical staff administer fluids and medications to support the patient's circulation and stabilize their condition. The announcement for Code H echoes through the hospital, alerting the blood center team to prepare for an urgent request. The blood center team rushes into action, preparing to fulfill the request for blood products.
Whenever there is a requirement of massive transfusion in any emergency, we get Code H protocol activated. Whenever we hear Code H protocol, the O negative packed red cells are transported within some minutes to the point of care or wherever the patient requires. We also do point of care blood group testing so that next blood units gets reserved for the patient immediately.
The ER team begins transfusing the blood and blood products, replenishing the patient's lost volume and restoring their hemodynamic stability. Monitoring the patient's response to the transfusion is essential. We need to ensure their blood pressure stabilizes and remains within safe limits. Once stabilized, the patient is swiftly transferred to the operating theatre for further intervention and surgical management of their condition.
In case of massive blood loss, code H is announced in the emergency department. Immediately, the blood bank rushes to the emergency department with the blood. Under the close observation, the blood is rushed to the patient. It is a life-saving event, and so, under the close observation, we are giving the blood to the patient.
As the patient is transferred to the intensive care unit, their journey through the emergency department marks just the beginning of their path to recovery. Thank you for joining us on this journey through the ER at Jahangir, where every life is precious and every moment counts.